morning everyone, my name is Jason de la Cruz and today I'm demonstrating to you the proper bag technique. So, bag technique is a tool by which the nurse uses when performing a procedure in the community. So, this bag technique saves time and effort for the nurse and at the same time provide effective and efficient care to the patient. The first step is assembling the equipment needed for the procedure before going to the community. So, the more the CHN bag is organized, the more it is effective and efficient. And also, it saves a lot of time and effort in providing care to our clients. On arrival at the patient's home, introduce yourself and verify the client's identity. Explain the procedure you are going to do and why it is necessary and how or she can cooperate with the procedure. Example is, good morning ma'am, my name is Jesronel de la Cruz and I'm gonna be your community health nurse for today. Are you Miss Diane Carino? Right ma'am? So today, we will be performing a urine glucose test or a sugar test to determine the presence of glucose in your urine. So that will indicate if you have a high blood sugar level in your body. So, by introducing yourself, you establish rapport and build trust relationship to the client. And also by explaining the procedure, you let the client to be aware to the procedure to be performed to her. We're now performing the bag technique. First is place the bag on a table with clean paper cover. The clean side must be out and the folded part is the one touching the table. The purpose of the clean paper cover is to provide a clean area to the CHN bag and the tools to avoid contamination. Next step is ask for a basin of water or glass drinking water if tap water is not available. So the importance of this is the water is gonna be used for hand washing. Open the bag and put out the towel and soap. Proceed to hand washing and wipe to dry. So, the importance of hand washing is to minimize the microorganism or pathogens to prevent the spread of diseases. Up the apron and put it on with the right side up. So, the right side of the apron is the one exposed, so that when we fold back the apron and put it back to the CHN bag, the wrong side is the one touching the tools and equipment, in order for avoiding contamination. So, next one is put out all the necessary articles needed for the specific care. The bag in one corner of the working area. So, the rationale of this is to cut. So, it is more efficient and easier to work in a working area where everything is organized. So, next is perform the specific nursing procedure. After the procedure, clean and dry all the equipment used and perform hand washing. Open the bag and put the equipments in their proper places. Remove the apron away from the person. Soiled side in and clean side out, and place it on the bag. So, the rationale of this is the soiled part, the soiled side is the one exposed, and it shouldn't touch the inside of the bag. So that when we fold it, the soiled side should be inside, and the clean side is the one that will touch the inside of the bag to avoid contamination to the CHN bag. So, fold the paper cover and put it in the bag. Side of the paper cover that touches the table should be folded inside to avoid contamination. Take the record and talk to your client. Explain the result to the client about the procedure and teach also some health teaching. So, lastly is make an appointment for your next visit. Note the date and time. So, the importance of the patient's home. Introduce yourself and identify the client's identity. Aliwa!